Okay. All right. So welcome, folks. Thanks for being here Monday morning after a shift in our schedules here. I hope that the week is off to a good start. We are getting together this morning for our fiscal year 2025 local planning and contracting guidance webinar. So we do this every spring as a way of launching our spring planning conversations with you all. Appreciate you being here. And just as a reminder, we do ask that every local public health agency contracting with our prevention services division have some representation at this meeting. And we will provide a recording of this call in follow-up today. We've got a few folks from our state team on the call, so I just want to highlight who we are. So I'm Tara Entwistle. I'm our lead local liaison on our MCH local support team at the State Health Department. Reed, one of my counterparts, is here, and you'll hear her voice as well. Several of you work with Reed as a local liaison and contract manager as well. We've got Sherry Hubbard, our fiscal officer. She'll speak to the budget component of planning. And then looking around, I see Angie Goodger and Veronica Para are here. They're both from our Children and Youth with Special Healthcare Needs team, and they'll speak to that component of your planning. Who else do I have here? Am I missing anybody from the state team, folks? Got everybody. Oh, I see Laura Zuniga hopped on. So Laura, good to see you here. Thanks for joining. And I think that's it. So we'll jump into our content. If you haven't already, please add your name and the agency that you are calling in and representing today. It just helps us to know who's here. So add that into the chat. Just a heads up, topics for today. Again, FY25, believe it or not, contract planning. We start early in these conversations. So we'll speak to, you'll see our faces from our local support team in just a moment. We'll speak to our MCH framework, which I know you all are well versed in now. Our contracting content for FY25, which includes our renewal process, the planning documents that we'll be looking for from you, our children and youth with special healthcare needs requirements. You'll hear from Sherry about our budgets, and then we'll do some polls and some wrap up. So just as a heads up, we will do some polls kind of throughout. Hopefully that makes it a little bit more fun and engaging and is a way for us to check for understanding in the group and just be sure that we're communicating really clearly, because that's important to us, especially in this conversation. All right, welcome to those of you who are just jumping in. So FY25 contract planning. This is our local support team. So hopefully these are some familiar faces on the screen. We've got Liz Sanders, who's our MCH section manager and deputy director. Myself, Tara Entwistle, Reed Bryan, one of our local liaisons who works with several of you, and Sarah K. Moore, who works with also a local liaison on our local support team, who works with our agencies that contract through OPHP, who are not present today. They get a smaller award from the MCH grant. And as local liaisons, we provide technical assistance to support the implementation of your MCH priorities in local communities across Colorado. As you know, we're also contract monitors, and we can guide local teams around processes pertaining to local planning, your logic models, your action plans, budgets, reporting, and evaluation. And we serve as the primary points of contact for local public health, and really what we like to call kind of a communication hub for our state MCH staff who are working with local public health agencies as well. So we gather our state colleagues connected to your work on a routine basis to review your reports, to discuss how we can best support you, to prepare for upcoming check-ins, review your plans in the spring, etc. And thanks, Reed, for the reminder. If you're jumping in now and you haven't already, please add your name and agency to the chat. Helps us track who's here. All right. And here's our MCH framework. So you all should be pretty familiar by now with this visual, but just a quick reminder that this is our current MCH framework. It includes our 7 priority areas in blue, our strategic anchors in burgundy. These tether our priorities to a shared vision. And as I hope you've already witnessed, they are a lens through which we make decisions in the MCH program statewide. And it also includes our 3 health impact areas, which are an important component of what our state team reports on to our federal funders. So I will just add a quick link to the chat to our interactive framework in case you haven't check that out on our website. Oh, shoot. Sorry, that was a private chat here to the full group. All right. And our contracting goals are really to use our funds, our MCH funds, in the most effective manner to serve maternal child health populations. It's always a goal of ours to support flexibility for you all, to align your MCH work with other funding streams or programs and your public health improvement plans. We are working more and more to tell the story of our impact statewide through our reporting. We also have a storytelling project and lots of spaces to be able to highlight what's happening locally within our MCH Digest, and other spaces as well, as you'll see throughout the year. And then, of course, to meet state and federal funding requirements. And the process for you all, for our local agencies, such as developing your logic model and your action plan each spring, mirror our state process closely. So our state priority coordinators go through a similar process, but there are a few things that are different for our local public health agencies. So you all are contractually obligated to fulfill a scope of work. And so you're monitored to ensure you're meeting your deliverables through quarterly reports and progress check-ins that we do 3 times a year. Your contracts are cost reimbursable, so you submit an annual expense budget. And then, as you know, you invoice monthly based on that budget. And because of this, the tools and templates we use for our locals are consistent across the program to ensure consistent and fair monitoring practices. But the work can be really individualized within those common formats. So a bit now on that statement of work that you all need to fulfill and how action plans inform your contracts. So October 1 of this year, 2024, is going to mark the beginning of year 4 in implementing our priorities for this 5-year cycle. A couple of points to cover are the statement of work has not changed for next year. So this means that we will use what are known as option letters, and local agency signatures are not required. So later in the summer, likely late August, early September, you all will get a copy of your option letter. It will come through the DocuSign software that you've received it through in the past. And so we'll ask that you please download a copy of that file for your records from there. And you can always contact Reed or I as your local liaison if you have any trouble accessing that. We can make sure we get it for you, because we know that comes up from time to time as well. And here is a snapshot of your fiscal year 2025 planning documents. So these are the major files that we'll be working on in partnership with you in the coming months in preparation for fiscal year 2025. And most of this will look pretty similar to previous years, although we did make some changes to the budget template, which Sherry will speak to and show you a screenshot of shortly. So you'll get more information on that. But just a heads up that the budget templates will really need to be updated to align with the work in your action plan for fiscal year 2025. So you really want to see the two kind of mirror each other. So what's in your budget should be also in your action plan and vice versa. Your action plan is going to be a copy of the plan that you're currently implementing in fiscal year 2024. So the content in that plan is going to be very familiar because it's what you're currently working on, but it'll be a new copy of that file. So you'll have an opportunity to revise it for the upcoming fiscal year. As a reminder, your children and youth with special healthcare needs work, including HCP care coordination, continues to be integrated within the priorities and should be reflected in the appropriate action plans. And these are built into your statement of work by reference. So this gives us the flexibility to adjust your action plans in partnership throughout the year as necessary. So again, the action plan is built into your statement of work by reference. It's a link, I believe, within your statement of work. So we can adjust the action plan throughout the year as needed. Your logic model is a file that likely won't have as many changes as you plan for fiscal year 2025, but it might have some. So you want to make sure that you revisit it every year to make sure it still reflects the work and your expected outcomes. If you make changes specifically to the objectives or strategies on your action plan, that's where you'll really need to go back to your logic model and make sure that the work is in alignment. And just a heads up, within your action plan template, you'll have a link to your current logic model. And so that should be easy to access, but we'll also be sharing those links, Reed and I, with you all in follow-up to today's call. So you can make, when you're looking at your logic model, you can make changes right in that same template that you've already been working in. That one's not going to be a new file. We sent out last year for the first time a contact form, very kind of straightforward, just asking for a contact, one additional person besides your designated contracting agent within your local agency that will receive your executed contract via DocuSign. In most cases, that's the MCH manager at the local level. We will share this contact form with you again this year during planning season and ask you to fill it out. It's meant to simplify things so that you do get those files when you need them. Programmatic folks as well as contractual folks at the local level. And just a heads up that Reed or I will be sending those via email to MCH managers before the end of the month, within the next couple of weeks, and definitely before April 1st. So you'll be receiving those very soon. And between now and May, you'll be updating the templates to reflect the work you plan to do in fiscal year 2025. So you see the due dates at the bottom in orange. Action plans and budgets, the drafts are due May 13th. As you know, we're here to partner with you and strengthen those drafts so that they're ready for final submission on June 13th. And we've got lots of folks on our state team who are ready and willing to connect with you in check-ins and beyond to talk through your plans and make sure that you're feeling good about them. So we've got, myself and Reed, we've got our SHIN consultants, we've got Sherry here, our fiscal officer, and our different priority leads. And so we're all here to provide support as you update your plans. And I've got a question in the chat from Daphne. Will these slides be distributed? Absolutely. We will share them alongside a recording of today's call in follow-up to today's meeting, Daphne. All right, I'm going to pass it along to Reed now to speak to the process of changing priorities in case you're thinking about doing that for FY25.
Good morning, everyone. Yes, as you're thinking about your work for FY25, just a quick reminder that if you want to delete or add a priority, it is required to fill out a sunset and readiness tool. So this tool is completed in collaboration with your local liaison and priority coordinators as needed to assess your agency's readiness and capacity to implement a new priority. So if you wanted to add an additional priority, that readiness assessment is required. And then if you are deleting a priority, the sunset tool is required. And this is just a couple of questions to outline your plan for transitioning away from that work in that priority area. So on this slide, you can see there are sample questions for this tool. As an example, the blue section at the top has 7 questions that are just like overall considerations. I don't expect you to be able to read them very well, but just giving you a snapshot of what those look like. And then the green section is an example of questions would be specific to adding economic mobility priority. And again, the setting tool is even simpler, just kind of outlining the communication with community if you are transitioning away from a priority and whether that work would show up in other priorities. So the way it works, MCH local liaisons would email an agency a customized link of the tool. So if you are planning on deleting or adding a priority, please reach out to your local liaison. And next slide, please. Thanks so much, Tara. Just a quick reminder, the local support team uses action tags as a communication for getting feedback when team here at the state is reviewing both your draft action plans and your draft budgets. We've also begun incorporating this into quarterly reporting. So you'll see those tags showing up at your Foursquares as well, as a side note. But these tags are just to really clarify what the state team is expecting or not as they review your plan and leave comments. So sometimes our team is simply being supportive. For example, the celebrate tag, we like to celebrate your work and all the great things that you're doing. Other times we're offering to be a thought partner and asking you to consider, optionally consider an idea. So you'll see that in the consider tag. And then when a response is warranted, we'll be very specific using the clarify tag to clarify something we're unsure of, or the edit tag if we are asking for a change or an addition. So a local liaison, Tara or myself, will help provide some continuity and oversight to this process, letting you know when our state team is finished with their comments, and so you can go in and kind of address and respond to those comments. Please don't resolve those comments. We're just kind of tracking the process, so your local liaison will be responsible for that once they are addressed. And incorporating our strategic anchors. So last year we began incorporating the strategic anchors of community inclusion, racial equity, and moving upstream into our action plans. So it should be more familiar this year. In the next slide, I'll show you a screenshot of the drop-down menu, just to remind you of where that shows up in your action plans. Essentially, you are tagging which activities are tied to which strategic anchors, and it is not required that every activity in your action plan have a strategic anchor. We're just asking you to tag where they are showing up and where you're thinking about them and integrating them. So you can also select NA or not applicable, again, not required for every single activity. To authentically incorporate these strategic anchors, the truth is you probably should spend some time reflecting and thinking about how they're driving your work and showing up your work before deciding on some of those objectives and activities. So yeah, really be intentional about how those are showing up. And we have a list of resources listed on this slide, which you can click on when you get those slides in follow-up to review, or you can also reach out. We have consultants here, strategic anchor leads here at CDPHE. They'd be happy to support as needed. And as promised, the next slide, here's the screenshot. Just a reminder of what they look like on your FY25 action plan. So you can see there is a drop down option next to the activity, and you can select the strategic anchor or anchors, or NA if it doesn't directly connect to strategic anchors. So we give you all the options of how they might combine community inclusion and moving upstream, community inclusion and racial equity, moving upstream and racial equity. As a quick example, let's say you are meeting a group of young people to identify priorities as one of your activities. So this would directly connect to community inclusion as a strategic anchor. And then if it was meetings you were having a explicit focus on including the voices of youth of color or looking at data to address causes of racial inequities, then you would also select the racial equity angle. So now I'm going to transition it to Anne, talk about youth with special requirements for planning.
Great, thank you. Good morning. I'm Angie Goodger, and as Reed said, I work in our children and youth with special health care needs section. Please, who's doing that? So over the next month, I will be your point of contact, and I am. So let me finish my thought while that's getting reconnected. So Veronica will be going on family leave. And so if you have any questions during the planning process regarding either your children youth with special healthcare needs work or your SHIN work or HCP programming, you can feel free to connect with me. Do we have the slides?
Angie, are you able to hear me?
Yes.
Okay.
Can you not hear me?
I know, I'm realizing it's a problem on my end, so I apologize, folks, because I'm the one sharing the
Okay.
screen here. I'm gonna try again, and if for some reason it disconnects, Reed, would you mind jumping in to share screen? Okay, thank you so much, and apologies for the interruption.
There we are. Okay, great. So as far as our SHIN requirements go, there are no changes this year. So we'll just do a quick review here. All agencies are required to specifically address the unique needs of the SHIN population. So you may have a strategy, you may have activities, but you do need to have that within at least one of your priority areas. You are able to use a combination of SHIN-specific strategies and general community strategies that incorporate your SHIN activities to meet those requirements. So let's say you have a strategy that really embraces the entire MCH population. Perhaps you have an activity or two that help you really narrow in and be specific to the needs of the SHIN population. On the third bullet there, you are allowed to subcontract with other community-based partners using your MCH funds to implement your strategies for the SHIN population. Fourth bullet, if you are receiving over $2,000 in MCH funds, you do need to plan on trying to spend at least 50% of those funds on the SHIN population. And if you are an agency that is currently implementing HCP care coordination and you're interested in exploring transitioning away from that programming, you are still required to facilitate a community conversation using our SHIN decision tool. And again, if you have any questions on that, feel free to reach out to me. Hopefully what I put in, I didn't even look, but hopefully what I pasted in the chat works and it gives you that information. So let's go ahead and slide into the next slide. Thank you. With respect to our HCP program, again, there are no changes for FY25. So if you are currently an agency implementing HCP requirements, a little bit of a echo.
It looks like there's someone with a 914 number. Could you mute?
Okay, better. So if you are implementing HCP currently, you'll continue to be required to adhere to our requirements that we have in our policy and guidelines. There's a link within the document, including documenting your work in CDS, unless we've had other conversations that have allowed you to change that. And there's a few agencies, you know who you are. HCP care coordination does need to be included within your action plan. And
okay.
Sorry, Michelle.
All right. I'm glad you got home.
There we go. Thank you. So please do include it in your action plan at either the activity or strategy level. You'll use that same formula that we have in previous years for setting some goals around how many individuals will be served within HCP. And again, if you want to explore moving away from HCP, it needs to be included separately within the action plan, and you still continue to meet those minimum HCP requirements until you've completed that decision tool and change plan process. Okay, next slide. So this is a change to sort of the administrative component. So for FY25, we have moved the HCP tab where you have historically done your planning and your data entry. We've actually moved that from your Foursquare to the planning documents, to your action plan. So that tab will be moved over. So again, it'll include at the top now, it includes your planning form. And those are due, your draft will be due May 13th, just like everything else, and a final due on June 13th. And you'll continue then to do your data entry below in the quarterly sections, but then your narrative will continue to be going into your Foursquare. So when you talk about the work, when you talk about your partnerships, those components will still go into the Foursquare. What also is new is that we have worked, or we will be working, I guess I haven't done it yet, but I'm working to, when you complete this document, it's going to automatically populate over in the in your priority, wherever your care coordination priority work is located. So once you have set your goals, it's going to show up as a goal. Once you have put in your first quarter numbers and it's calculated sort of where you're sitting, it's going to go ahead and put that into where your targets are going for each quarter on your action plan. And so if you're having a hard time following that, because it is a lot of information, we can talk about it and I can help support that. And I think once we actually get it all connected, get those formulas in there, and you see and receive your document, it'll be a lot more clear too. Let me make sure that I have everything else here. So was there anything else that I wanted to say? I don't think so. So hopefully it really does streamline and simplify your data entry and your reporting. And as always, if you have questions, just reach out and we're happy to help support you, as you complete your forms and as you do your reporting throughout the year. Thank you.
Thanks so much, Angie. And now we're gonna check for some understanding, check that you're still awake. I know daylight saving time is rough, getting up an hour earlier. So Tara, I believe you're gonna launch those polls, or did you need me to?
Can you hear me, Reed?
Yeah.
Okay, I was a troublemaker calling in. So apologies, my video and audio aren't aligned, but I'm glad you can hear me now. I think I'm going to stop sharing to launch polls. Well, let's see if I can do that. All right. And yep, great. So I've got some program contracting questions based on the information that we all just heard. And let's see.
Okay, so the first one, the HCP planning form and HCP quarterly reporting will now be on a tab in the FY25 action plan, true or false? And Tara, I am seeing just the questions. Oh, there we go. Perfect. And they're updating. Are you all seeing the poll? Just making sure, thumbs up that you can see the poll and edit the poll.
Yes, it looks like we have to answer all the questions before we press submit.
Oh, got it. Okay. So we're not going one by one. That's fine. So most folks are saying true to the HCP planning form and HCP quarterly reporting being on their FY25 action plan. You got that. Angie just went over that. So hopefully that was fresh in your brain. Fill in the blank. If changes are made in the objectives or strategies on your action plan, you will need to update your what to continue to keep the work in alignment. And your options are statement of work, logic model, or option letter. And looks like most folks got it. Logic model is correct. So if you update your strategies or objectives in your action plan, go back to your logic model and make sure those two still align, because your logic model is kind of where your planning, your understanding theory of change and model for how your work goes into outputs and outcomes. Perfect. All agencies will be required to specifically address the unique needs of the SHIN population with focused strategies and activities. And the options are within at least one priority area across all their selected priorities, or only if they receive $200,000 in funding. A little bit more spread out across these ones. And the correct answer is within at least one priority area. So SHIN work should be integrated into your MCH priority work. The 200 or more in funding is only a requirement of spending for certain agencies, but all agencies are required to integrate the SHIN work into at least one priority. Local public health agencies will receive their option letter, contract renewal, and changes via fax, carrier pigeon, or DocuSign. Everyone got that one. It's DocuSign. And then signatures are not required on option letters. This is a pretty important one. And I see we're kind of split. That is true. Because your scope of work has not changed, the option letter is just essentially a notification that your contract will be renewing, and you are not required from our perspective to sign it. I know some agencies have their own processes on your ends. Perfect. So I think we're going to launch right into budget development. I'm going to pass it over to Sherry to talk about budgets.
Good morning. I think I've worked with most everybody. This is, I think, my third year doing budget developments with you guys, second or third year. So hopefully we will just continue the work we've been doing. If you want to go to the next slide, please. So just a couple notes. Budget development, we're going to continue to use the unified MCH budget and invoice process to support your work. Annual population spending estimates are included, and it's to help us reach our federal reporting requirements that we must do on the work that you guys are doing. And the quarterly Foursquare report provides space to indicate when a budget change occurs that impacts the annual population spending estimates. So just keep those in mind. Typically they don't change, but if there is a major change, you will want to. Next slide. Please indicate EDI in the item description for equity-related expenses. So if you're doing supplies and operating and it is within the equity-related expenses, just write EDI in the description of that line. You may also be specific equity-related expenses in training, personnel, or contracts. So just keep those in mind to call out all the EDI expenses. Next slide. We listened to you guys. We heard your concerns. So we are trying a new budget template this year. So what we did, instead of you guys having a population tab and a contracting tab, it is all in one worksheet, one thing. So there is no duplication of moving things from one tab to another. It will all be on one sheet. So hopefully you guys will find this. It might be a little wonky this year. Just anytime you do something new, try something new, it can be a little wonky. But we're hearing you. We understand the two tabs was frustrating for you all. So the new budget template is, again, one sheet. You have your contracting on the left-hand side, and your population budget will be on the right-hand side. So you'll only need to enter in position titles and description of work once, but you do still need to break out each cost by line item by the population. Again, that's just for federal reporting, so we can't get away from not doing it, but hopefully doing it in this manner will make it a little bit easier for you guys. There is a check on the budget. You will see on this slide, you can see calculation check must say true. So anytime that there is a false over there, that means whatever is in your population budget is not matching the total in the expenditure in the contracting budget. So that will be a good check for you guys. That's very visible. Is everything lining up? Is everything accounted for? Again, I'm working on the instructions on how to complete this. But again, I find it really hard to write instructions for something you created, because in my head it all makes sense and it's easy to do. So if you have questions or something is not making sense, please reach out. I'm not offended. Or if something is just not working, reach out. Again, this is something new for this first year, so we understand there may be some modifications we need to do or tweaks that we need to do to make it easier for you guys. But again, we heard you. We're trying something different. These will be sent by Reed and Tara again in the next couple of weeks, like they said. Next slide. Let me grab a drink really quick. So again, you guys have been doing this for a while, most of you. So there are three populations. Population A is women of reproductive age. Population B is infant, children, and youth. And population C is infant, children, and youth with special health care needs. So just a little reminder of what each population is. Next slide. On the right-hand side of the budget, template, you will see each population, population A, population B, population C. So you will be required to split out each line by those populations based on the work that you're estimating to be doing. Next slide. At the very bottom of the right-hand side of the budget template, it will summarize the total amounts for each population. So those are things that we had in the population tab of the old template. They're just now going to be on the right-hand side of the budget template at the bottom now. Next slide. Changes to amounts on the contracting side must also be made on the population side. There is a tan line that's dividing the two budgets. But again, just make sure all your columns say true and you will be good to go. And that is the triple check column Q for any false items. So make sure everything is saying true. When you're doing formulas, only go out one decimal place when you're doing formulas within the budget. When we do these budgets, we have to take your contracting budget, download it into Excel, and then mark it precision as displayed. So if you go out more than one decimal place, it makes the numbers not work when we do that download to execute your contract. So just keep that in mind. And then please make sure the grand total is a whole dollar amount and it is equal to your award amount. On the population side of the budget template, you will have your award amount pre-populated in there. So it will be an easy check for you to see that everything is matching up to that amount. Indirect calculations. So there's three types of indirect. If you have a federally negotiated rate, if you have a CDPHE negotiated rate, or the de minimis rate. If you have a federally negotiated rate, you are not allowed to use the de minimis rate. You must use your federally negotiated rate. So just keep that in mind. If you are going to use the de minimis rate, make sure that you know what expenses can and cannot be included in the modified total direct cost, and that you're calculating that correctly. And organizations who are claiming the 10% de minimis rates, it is 10% of modified total direct costs. Based on the indirect, it must exclude the cost listed on the previous slide from the indirect calculation. So rent, participation support, subawards over 25,000, those kind of things. So just make sure it's calculating correctly. These costs are still allowable on the grant, but they're just not allowable in your indirect calculation. If you have a different indirect cost base, total direct costs, total dollars and fringe, this does not apply to you. That's a federally negotiated rate or a CDPHE negotiated rate. So it is only for organizations who are using the de minimis or using modified total direct costs as their indirect base. When reviewing budgets using the modified total direct cost, I will be looking at anything that should be excluded that maybe you just aren't calling out as a participation support cost or kind of is buried in another description. So registration for coalition members is a participation support cost. Incentives, gift cards are participation support cost. Travel reimbursements for non-employees is not allowed in the modified total direct cost. Any costs being offered to agencies to defray costs of participating in a meeting. So just keep those in mind, that I will be reading the descriptions and asking for clarifications on any of those kinds. If you want more information, you can go to the CFR 200.68 and 200.75 for more information on modified total direct cost or indirect cost in general. Next slide. I will do my best. I started this last year, so it's been a learning curve for me to use the edit, clarify, consider, and celebrate within your budgets when I am making comments. Reed and Tara are really good at helping me stay on track with those call outs. So again, I'm finding that this year will be much better than last year. I'll just improve this year. That's my goal. Next slide. When completing the budget form, you will hear us refer to budget lines as open or closed. If you do not open a budget line, you are not allowed to have expenses against that budget line. So if you are not sure if you're going to have travel or not, and you don't put any funds in the travel line, that is considered a closed travel or a closed line, and you will not be able to charge any travel that may come up unless we do a budget amendment or a contract amendment. And those are only retroactive, they're not retroactive, they're only prospective. So if you think you're going to be doing travel, just put something in the travel line. But make sure that you're opening money, which is just adding money in that line. Again, just a reminder that we do set precision as displayed when we download it to Excel. So going out only one decimal place is helpful. The hidden decimals will not be included in the calculations, and it can throw off the totals by a few dollars. Cost must be reasonable, necessary, allocable, and allowable. Reasonable and necessary, you can ask yourself, is the item of cost necessary to complete the work plan? Is the cost reasonable? Allocable, is there a logical connection with and to the statement of work? And allowable, is a cost allowable by the funding source? A lot of times you guys can go to the CFR 200. There's great information on what's allowable, what's not. There's more definition on reasonable and necessary and allocable. So now we're going to go into a little bit more detail on just a couple costs in general. Food is always a big one. The purchase of food and beverages for MCH is considered reasonable and necessary when all three of the following conditions are met. The meeting advances MCH planning, implementation, and/or evaluation. The purpose of the meeting is to engage the community as partners and stakeholders, and the majority of the meeting participants are external to the host agency. All three of these requirements must be met in order to have the food or beverages allowable. One thing that is absolutely not allowable under any circumstances is food and beverage for meetings, trainings, or other type of functions intended exclusively by internal staff. Staff development and training. If you have, MCH does support staff development and training. If the development and training is MCH specific and required for the grant, you can charge all of the staff time and travel costs to the MCH grant, no matter the percent of time spent on the MCH grant by that employee. If the staff development and training that supports more than one funding source, it must be split by the percent of time spent on each grant. For example, you have a full-time employee who is funded 50% by MCH and 50% by other funding. That person attends a training that's not required by MCH or only specific to MCH. The cost of the salary and benefits and travel-related expenses must be split 50% to MCH and 50% to the other funding source. This is my contact information. That is my cell number, my email. I'm always available for questions that you guys have. It's better to ask questions and ask for permission than ask for forgiveness, because sometimes we're not allowed to forgive. Just the way that the federal dollars work, we're not always allowed to forgive. We try to find a way, but again, it's better to ask for permission than forgiveness.
Thank you so much, Sherry. And Sherry is so willing to help you all with your budgets. If there are any questions, sometimes it's just easier to meet on a call for 10 minutes and go over something if there's any questions or confusion. So please reach out to your local liaison and we can set that up to coordinate with Sherry. who is always super helpful. So we're going to do another review. And Tara's going to launch the polls. I think they're going to launch multiple questions again. So we'll just go one by one. But the first question is, as long as the meeting is external to the host agency and its purpose is to engage community in advanced maternal and child health work, food can be provided using MCH dollars. True or false? Oh, this is an
Can I
easy
ask a
one.
clarifying question?
Yeah, please, Daphne.
The piece that feels like it's missing here is, and it's in your budget.
Correct. Though if you have the budget category open, you could add it in. Sherry, you can chime in as well. So if they haven't explicitly called out food in their budget, could they add it to their budget later is the question for you, Sherry.
As long as the supply and operating line has money in it, then yes, the line would be considered open and you would be able to charge food to that.
Much more clearly said than I. Perfect. Supply and operating is where food typically falls under. So that budget category has to be open in order to add food budget there at a later date. Great question, Daphne. Thank you. Okay, so y'all got that one right. It's true. It has to be external and to engage community. Second question, fill in the blank.
Sorry to interrupt you, Reed. I separated the questions out, so I think I can end it and launch the results one at a time this time around.
Okay. %, A+. Okay, fill in the blank. Please indicate EDI in the item description for blank related expenses. And your options are children with special healthcare need, food and beverage, or equity. You all are correct. If you said equity, that is correct. So we are tracking how budgets are set aside for equity related expenses such as language justice, interpretation, and translation of materials as an example. And so we want to kind of be able to track that. So if you code it for us, that will make our job easier. Okay. Tara's sharing those results so you could see. Poll number 3, allocating funding to each budget category is a good strategy for, and you can choose all that apply, I believe. Perfect. So we're kind of split between the first and third option, giving your team flexibility to spend down your entire MCH award, and avoiding a budget amendment, which is required when opening a budget category once the fiscal year has begun. So both of those are correct, 1 and 3. As Sherry mentioned, if that budget category, like the supplies category, doesn't have any funds in it, then it is quite a process to try to get that open. So if you think you're going to have supplies, put something in there so you have that flexibility. Tara's sharing those results. A little humor for a Monday here. Ensuring the budget categories feelings don't get hurt. Poll number 4, if the total amounts reflected on the contracting and population sides of your combined budget template do not match, column Q all the way to the right will indicate error, false, or mayday.
I kind of want to change it to Mayday, Mayday.
Okay, so the answer is false. So Sherry added basically a check to make sure that the numbers that you're putting on the contract budget match the population budget. And so if those don't match, it will say false, and that means you need to address that, figure out where they're not matching. So they should all say true, 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 and then you are good to go. So thank you for playing. I'm going to pass it over to Tara to close us out.
All right, thank you all. Can you see our screen here again? Note about unspent funds.
Oh, yes. And I think that was mine. I'm sorry, Tara.
That's okay. Do you want to jump back in, Reed?
Either way.
Okay, I can take us to the end if that works better. Thanks, Reed, for facilitating our polls. You always do a great job with those and making sure that the messages that we want to get across also are really clear to the group. So hopefully the questions highlighted some of the things that we thought were really important that you all take away today. And we might get an update from Sherry that she's going to change the cell to say Mayday, Mayday. So we'll keep you posted. Just a quick note, parting note before we end our call here. So program and fiscal staff in our prevention services division at the health department are committed to supporting contractors, grantees in fully utilizing your awards to implement your scope of work. We regularly review your spending data. If you do anticipate that you'll have trouble spending down your funds this fiscal year, please contact your local liaison, so myself or Reed, and just chat with us about it before June to see if a budget revision might be needed. The deadline for a budget revision for the current fiscal year is June 30th. And then a heads up that we will do a fall webinar. So we do 2 contracting related webinars during the fiscal year. This is one of them, the spring one that's oriented towards planning. The other is in the fall, and that's as we launch a new fiscal year. So we will have one in October of 2024 that'll kick off fiscal year 2025. We'll go over your final report for the current year, your contractor performance rating, which is a requirement of our contract monitoring program at CDPHE. We'll go over implementation, technical assistance, progress check-ins, invoicing, et cetera, for the new fiscal year. And we'll share any updates to our MCH guidelines, document, and invoicing going into the new year. So you will get a notice about that from myself and or Reed in the coming months as we schedule a date, again in fall. And then a quick moment, we do have just a few minutes here before 11, so please add to the chat what remains unclear about the FY25 MCH planning season, if anything, and we'll keep an eye on it. And thanks, Reed. She already put a note to get you all thinking about if you have any questions. Thanks, Daphne. And the question from Daphne is the funding flat for FY25? So in other words, will the awards be the same in FY25 as they are in FY24? Am I understanding that right, Daphne? Yeah, and the answer is yes. So the funding source is a flat funding source that we get from our federal funders, and so year to year it does remain the same. If there are changes, we will for sure be letting you know, and hopefully in the future there will be increases, but for FY25 it will be a flat dollar amount, same as you've received in FY24. Thanks, Wendy. Anything else that's unclear, folks? Okay, I see some people jumping off the meeting. I know we all have a lot of back-to-back calls. So if anything comes up after today's call, you've got me and Reed and the rest of our state team to support answering questions. So feel free to reach out. And as you all are familiar, I hope, here's our contact information. Oh, apologies. Here's where we'll post the recording and slides from today on our website. And then last but not least, our contact information for myself and Reed. Thank you all for your time, and we'll talk to you soon.